Hi, I'm Dr. Joma, the sports med specialist. Welcome back to my channel. So this quick clinical bite is about progressive overload, or more specifically, load management. When we have a good progressive overload, we give sufficient growth stimulus to whatever area that we're looking to strengthen and rehabilitate, the best chance it has to gradually get stronger over time. When I talk about load management with my patients, I give this idea of climbing Everest, which means gradually increasing the amount of work you're doing, but then having little base camps where you back off before you build back up again. What I always counsel patients against is a boom bust pattern of loading, which means that they do all the work on one day, overload themselves, feel really fatigued, and then have a total day off or a few days off thereafter. This patient's graph shows some of the best, but also some of the worst aspects of load management. As a general rule, you want to try and avoid this boom bust load pattern where you have days of high load. So here he's walking 2 kilometers a day. Here he's walking 3.5. Here he's walking 4.5. But then sporadically mixed in between, you have these periods where you only have 0.5 kilometer or less. Ideally, you want all of these blue graphs to be about the same height. What does look good, however, is this cumulative overload pattern. And it has this climbing Everest approach, which is you increase and then back off. Increase, back off. This little X here shows a pain flare and a massive crash in their load. This is what we don't want to see. This graph actually isn't too bad up until this point. As you can see, every single period where there's a sharp increase in load leads to a pain flare. Similarly here, a low baseline, a sharp increase in load, and a flare up in pain. So there you have it, a really good example of load management where it's done quite well and not so well at the same time. Thanks for watching, and I'll see you in the next video.